Welcome everybody. This is Professor Noradini. This lecture is going to be discussing the incarceration system. All right, so just to start this lecture, briefly reviewing the objectives. First, we're going to be discussing structural violence. In the previous modules, you learned about interpersonal violence. In this lecture, we're just going to discuss the difference between interpersonal violence versus structural violence. And discuss how that applies to the incarceration system. Next, I'm going to provide an overview of the incarceration system and review key demographic information and history about incarceration. Next, we're going to shift it to looking more at the health effects of incarceration in the general population, and specifically focusing on mental health needs. And then we're going to look at providing care to women who are incarcerated, more specifically pregnant women. And then at the end of the slide, we're going to be discussing nurses' role in providing care to families of the incarcerated. So what sort of services do family members of the incarcerated need as well? In the previous modules, you learned about interpersonal violence. And just to refresh your memory, it's the intentional use of physical force or power. And that could be threatened, it could be perceived, or it could be actual against another person or group that can result in injury, death, psychological harm, or deprivation. In contrast to that, we have structural violence, and this refers to systematic ways in which social structures harm or disadvantage people. It's often subtle or invisible. I know this term can be controversial, so it's helpful to kind of break this term up. Structural is referring to the embedded political, social, and economic organization of society. The violence is referring to causing harm to people. And this lecture is about the health implications of incarceration as well as the nurse's role in providing care for the incarcerated population. As nurses, we care for all, including those with a history of interpersonal violence and those who may have a history of being incarcerated or who are currently incarcerated. We also need to be mindful of how the correction system contributes to structural violence. In a few slides or later in this module, we're going to be discussing structural violence within the incarceration system. I'm going to start by reading this quote by Paul Farmer and then having a brief discussion regarding some of the implications. So Paul Farmer stated, "Structural violence is one way of describing social arrangements that put individuals and populations in harm's way. The arrangements are structural because they are embedded in the political and economic organization of our social world. They are violent because they cause injury to people. Neither culture nor pure individual will is at fault. Rather, historically given and often economically driven processes and forces conspire to constrain individual agency. Structural violence is visited upon all those whose social status denies them access to the fruits of scientific and social progress." What I like about this quote is that it removes the blame of structural violence on any one individual or groups of people. Rather, it kind of goes beyond that. What are the historical policies that contribute to structural violence? And I think that's really important to remember, especially in the way that sometimes groups of individuals may be vilified for contributing to structural violence. But really, we need to take a step back and look at it from a historical perspective. Here are some examples of interpersonal violence and structural violence. Go ahead and take a minute and see if you can identify which one of these would be classified as interpersonal violence and which one of these would be classified as structural violence. This slide is just kind of an FYI for those of you who are interested in learning more about the incarceration system. And really, the slide shows the complexity of the criminal justice system. It's not that you get arrested and all of a sudden you're enter the correction system. There's a little bit more to it. Before we get started in our discussion of the incarceration system, I just want to get started by reviewing some key terminology. Many people confuse jails and prisons, but they're actually very different things. Jails are run by the sheriffs. It's for people who are awaiting trial or serving short sentences. Prisons, on the other hand, are operated by state governments or the Federal Bureau of Prisons. It's individuals that have already been convicted of crimes. If they're convicted of a state crime, they go to the state prison, and if they're convicted of a federal crime, they go to a federal prison. These are often for more violent offenders and those who are going to be serving a long time in the incarceration system. One thing I would like to point out is that since the passage of Assembly Bill 109, the line between jail and prisons have become a little bit more blurred as more of the prison population has been transferred to the jails. And then I do also want to discuss private prisons. Private prisons were kind of created as a way to address overcrowding in prisons. It was seen as a solution for prison overcrowding, but then we have this ethical dilemma, is it our right to imprison people for profit? Fortunately, there was new legislation that was just passed in 2016, which is going to be closing most private prisons down. Included in the incarceration system are detention centers. So detention centers are often referred to ICE detention facilities, standing for Immigration and Customs Enforcement. Within California, we have 2 separate detention facilities, as well as having detention centers at 9 county jails or private prisons. These are largely for the undocumented population. Once in, there are significant barriers to counsel or nonprofit legal services and providers. Incarceration rates have drastically increased since the 1980s. One factor that strongly contributes to this are the stricter sentencing for drug offenses. So if you look at this graph, pay attention to the orange line that depicts incarceration rates for drugs. And you can see that all of a sudden there's a pretty strong spike that occurs in the late 1980s. And this corresponds with the beginning of the war on drugs. I know this graph is pretty busy, but it does provide a lot of valuable information and kind of shed some light on who is being locked up in the United States. Take a minute and review it, and then think back to our lecture on vulnerable populations. When we look at this, we can see that approximately 1 in 5 are incarcerated to a drug offense. And some other facts to kind of keep in mind is that 68% of jail inmates met the DSM criteria for drug abuse or dependence. So drug use is very prevalent within this population. And 50% of all convicted jail inmates were under the influence at the time of the offense. So even if they're being locked up for something else, they were under the influence of a drug at the time of committing either that violent act or damage to property. Now, when you're looking at the homeless population, they're also very well represented within the incarceration system. 25 to 50% of the homeless population has a history of incarceration. And researchers have found that the homeless were 7.5 to 11.3 times more prevalent among jail inmates than the general population. This graph depicts that minority populations are overrepresented within the correction system. This is especially the case for Black or African American community. And I also believe that this graph does make the case for structural violence within our current correction system. And what I want to do is just kind of take a minute and step back and try to understand, well, why this might be the case. I did do some brief research to try to get a perspective as to what may be contributing to the fact that the African American population specifically is overrepresented in the correction system. And I did find a report, and I'll quote this, that said, an examination of the growth of the prison population from 1992 to 2001 found that the entire increase was explained not by crime rates, but by an increased likelihood that convicted offenders would be sentenced to prison and by longer prison terms. And then I also found another study done by SAMHSA, and it found that while Blacks constitute about 13.3% of monthly drug users, they represent approximately 32.5% of persons arrested for drug offenses. So we see a disproportionate response within the Black African American community. Furthermore, what happens as a result of this is that 1 in 8 Black men have been incarcerated. And think about the effect that can have on the community when so many members of your community are isolated and separated through incarceration. And also think about some of the longer-term implications, wider range implications. If you are convicted of a felony, you're going to lose your ability to vote. And in some ways, this means that you've essentially lost your voice. Why are some drug offenders sentenced to jail or prison while others are not? One thing we want to look at to kind of understand this is looking at some of the old laws. As you guys are probably aware, crack and cocaine are essentially the same thing. Crack is a form of a cocaine base, yet they have very different sentencing. So somebody convicted of selling 500 grams of powdered cocaine is going to be subjected to the same mandatory 5-year prison term as somebody who only has 5 grams, is in possession of 5 grams of crack. So we definitely see a discrepancy in what is triggered for the 5-year mandatory minimum sentence. Newer laws passed recently have since decreased it, so now it's somebody in possession of 28 grams of crack, that'd be the equivalent of 500 grams of powdered cocaine, and now there's no longer a mandatory minimum sentence. It'll be interesting to see if that's going to help reduce the number of people that are incarcerated for drug offenses. Take a minute to study this graph on health in prisoner reentry. There are a few interesting points. Number one, we see that the main health issues for those that are incarcerated include asthma, diabetes, hepatitis B or C, high blood pressure, HIV or AIDS, and tuberculosis. Another thing that you may notice by looking at this graph is that many inmates receive more frequent health care visits during the time that they are in correctional facilities than when they are released. Take a minute and think of why you think that's the case. Are people sicker in correctional facilities, or do they have more access to care than they otherwise would? As we will see in the next few slides, being incarcerated can have a negative impact on your health. With that said, being incarcerated often increases access to health services as well. People in the corrections system are particularly vulnerable to the physical and mental health issues that are listed above. So looking under physical health, we see there are increased risk for infectious diseases, and this is because There's shared hygiene facilities, residential crowding, not as much air circulation, and high levels of intimate contact. They're also at increased risk of violence. One way that the incarcerated population mirrors the general population is in the variety of chronic conditions, although we're going to find that these chronic conditions may be overrepresented in the incarcerated. In regards to mental health, there are several things we need to consider, right? So when you are incarcerated, there's going to be that disruption of relationships between family and social networks. We should probably just stop and think about how those who have less means are often the most isolated because they can't afford any additional means of communication. For example, phone calls are approximately $1 a minute, and while that seems like a lot, that's a great reduction because phone calls used to cost up to about $14 a minute. But again, those who cannot afford those phone calls are going to be even more isolated compared to their counterparts who can. So we also have to think about cumulative stress as well. There's that primary stressor of just being incarcerated. But then there's secondary stressors because once you leave the jail or the prison, then you're going to have to face a new reality where you have reduced economic and labor market opportunities. You're going to be stigmatized. And you're going to have the less control and ability to control your own life, for example, not being able to vote. The nurse's role within the correction system can vary quite a bit. For those of you guys who are interested in learning a little bit more about the role of the corrections nurse, I have provided a link to a YouTube video where a corrections nurse kind of walks you through her day. It's about a 5-minute video and it's pretty informative. But the role can vary quite a bit, and we want to consider a few things that nurses can do at the individual level. One is just developing education and health promotion services. At this point, you have a captive audience, so you can discuss issues such as smoking cessation, sexual health, cardiovascular disease, and diabetes. Again, knowing that these are chronic diseases that are fairly common within this population. Specific older adult health care needs, as well as substance misuse and just general mental health issues. Nurses can also provide some wraparound services for clients who test positive for infectious disease, so they have access to care when they are released. Think back to tuberculosis. While you are in the correction system, you are carefully being monitored and being given your medication. We want to make sure that that continues once the client leaves the correction setting as well. At the systems level, we're going to want to be thinking about policies and policy changes. One recent change that occurred is with Medicaid. So the Affordable Care Act now allows incarcerated individuals to apply for Medicaid before they are released. This is important. So if you had access to health care or access to prescription medication while you were incarcerated, we want to be to ensure that those services can still be provided once you're released. And hopefully by continuing to have access to your psych meds, for example, that can also have some longer term impacts such as reducing recidivism rates. Nurses can also be active in working with groups or organizations that serve the formerly incarcerated and assist with kind of the transition back into the community. So by working with these groups, you can pass policies that would improve the transition back into the community and again, hopefully reduce recidivism rates. Health is a pretty big. As we have seen in previous slides, mental health issues is a huge concern for the incarcerated population, and it is something that the corrections nurse really does need to focus on. Just to review some of the statistics, 1 in 10 men and 1 in 5 females suffer from a mental disorder within the corrections system, And if you include substance use and mental health disorder, the number is going to be much higher. So given this, what is the nurse's role? Nurses are responsible for substance misuse management and addiction services. This can include running support groups, ensuring proper education is available, as well as medication administration. And we also want to manage mental health issues. So this includes depression to schizophrenia or psychosis. And again, this management usually entails medication administration, and it can also be a referral to a psychologist or a psychiatrist that would be on staff. At the individual level, upon admission, anyone entering the correction system needs to be assessed for mental illness and suicidal assessment, or suicidal ideation. And if somebody does screen positive for this, then it's going to be the nurse's responsibility to ensure the patient receives treatment for those conditions. At the community level, we're going to want to think about developing, implementing, and evaluating harm reduction programs. Now, these can be very controversial. So, for example, providing condoms within the prison is one example of a harm reduction program. And again, that has received a lot of negative attention, and it is seen as something that is controversial. We also have to consider the health needs of incarcerated women, specifically pregnant women. So about 6 to 10% of all female prisoners are pregnant, and we want to think about the unique mental health needs of this population. There's a certain amount of trauma associated with being isolated from your support system during labor. And again, being separated from your baby after birth. We also want to consider some physical health needs of pregnant women who are incarcerated. We know that they have a high rate of complications associated with STDs, so it's important that we provide screening. And we would also want to consider drug withdrawals within this population as well, not only affecting mom, but affecting baby as well. Given the unique factors of pregnant women who are incarcerated, we want to kind of think of what would the nurse's role be in dealing with incarcerated pregnant women. At the individual level, of course, we're going to want to screen for drug withdrawal symptoms, postpartum depression, and STDs upon admission and after birth. We want to ensure that there's proper nutrition while in the correction system. We want to refer to community agencies so that a doula can be present during birth. Families sometimes are not allowed to be with the woman while she's in labor, so there are a group of volunteer doulas who I'll discuss in a minute who can be present to assist with the birthing process and just provide some support. At the community level, hosting workshops and clinics on prenatal care and the child's birth experience, again, providing that anticipatory guidance of what to expect during the birth process, providing education regarding birth control and gynecological health, helping to facilitate nurse and doula-led educational workshops and support programs for pregnant women who are incarcerated within whatever corrections facility you may work at. At the systems level, I do want to highlight Birth Justice Project. It's a group of nurses and doulas in San Francisco and Oakland who have been very successful in helping to pass policies to help protect the health of both moms and babies. Some of their policies include allowing for women within the correction system to pump milk, to have an unshackled birth, so that means not being handcuffed while the woman is in labor. If you guys want to check out this resource, I recommend you go look at Birth Justice Project. And just want to share one interesting fact. One of the founders of Birth Justice Project is a CSU East Bay alumni. She was a student and a doula at the time that she helped start Birth Justice Project. So again, not only nurses can have a positive impact, nursing students can have a positive impact as well. And seeing the work that the Birth Justice Project has done has been really incredible. Inmates and prisoners are not the only ones who are at risk for poorer health outcomes as a result of incarceration. We also have to consider their children who are also susceptible. So think back to the ACEs study, the Adverse Childhood Event study that we discussed during the Vulnerable Lectures lecture. And what we saw was that adults who experienced adverse childhood events were more likely to have a variety of health issues later on in life and also engage in more at-risk behaviors. And also recall that an incarcerated parent was considered an adverse childhood experience. So in this graph, we see how having an incarcerated parent affects educational success. In the first part of the graph, we see the likelihood of being expelled from school. So overall in the general population, about 4% of children can be expelled from school, compared to those children who have their father incarcerated, where the number goes up to 23%. And looking at likelihood of graduating from college, again, general population, there's a 40% likelihood of graduating from college, compared to a 15% likelihood if a father's incarcerated, and just a 2% likelihood if the mother is incarcerated. And again, education is considered a social determinant of health. So how can having less access to education impact a person's health going forward? Fortunately, there are some resources available for children who have incarcerated parents, and I've provided a list of them for you guys to review. So anybody who's interested, I do recommend that you look into some of these agencies in more detail just to find out about some of the resources and services that they do offer. So making these sort of referrals would be an example of nurses providing care for the families of the incarcerated at the individual level. In order to develop community and systems level interventions, we would likely partner with some of these organizations to try to get some important policies passed. All right, so the key concepts that I hope that you got out of this lecture is number one, understanding structural violence. What is it? And would you be able to identify scenarios which depict structural violence? Then looking at health effects of incarceration, both physical and mental health needs of the incarcerated population. Understanding the unique health needs of pregnant women who are incarcerated. Understanding the adverse effects of incarceration, not only on those that are incarcerated, but of their family members as well. And finally, understanding the nurse's role in providing care for the incarcerated, whether it be families of the incarcerated, pregnant women, or addressing the physical and mental health needs of those that are currently in the incarceration system. So thank you so much for paying attention and following along. If you have any questions, I'm definitely happy to discuss this with you in more detail. I do know that some aspects of this lecture could be considered a little controversial, but again, I do believe in that discussion would provide growth for all those that are involved. Thank you and have a good day.